What if the answer to that lingering cough, stubborn skin rash, or restless night wasn't hidden in a pharmacy aisle, but was quietly sitting in your kitchen or bathroom cabinet all along? For many women, especially over 50, it can feel like nothing works anymore. You try supplements that overpromise, creams that underdeliver, or prescriptions that come with more side effects than benefits. But here's something most people don't realize. Some natural remedies really do work, and they're backed by science. Not just anecdotal tips passed down from grandma, though those often hold truth, but peer-reviewed, medically validated treatments used by real doctors, even in hospitals. There's a common misconception that natural means ineffective or unproven. The reality is quite the opposite. Many natural remedies were the original medicine. Now, modern research is catching up to confirm what traditional healers observed centuries ago. In this video, we'll break down 10 natural remedies that actually have scientific evidence behind them, ranging from soothing eczema and easing digestive issues to improving sleep and calming inflammation. You'll learn what works, why it works, how to use each one properly, and the mistakes to avoid. So stay with me to the end, because these aren't just tips, they're time-tested tools that could transform your daily health. Number 1, raw honey. Let me be honest, there's a reason why raw honey has been a staple in my own medicine cabinet for years. It's one of the few natural remedies that blends ancient tradition with modern science, and it actually works. No fluff, no fads. According to the American Academy of Pediatrics, honey outperforms some over-the-counter cough suppressants for children over age 1. And having raised 2 kids, I can personally say I've seen this firsthand. A spoonful of raw honey before bed often worked better than store-bought syrups, and without the artificial flavors or dyes. Scientifically speaking, honey creates a coating effect in the throat that reduces irritation. It's also rich in enzymes and natural antibacterial compounds. This is why I always reach for a jar of Manuka honey the moment a scratchy throat creeps in. How I use it. A warm mug of herbal tea with honey and fresh ginger is my go-to. On busy mornings, I'll take a spoonful straight if I'm feeling under the weather. But be warned, never give honey to babies under 1 year old due to the risk of Clostridium botulinum, which can be deadly. In a world flooded with gimmicky cough cures, honey stands out because it's simple, safe, and backed by science. Sometimes the best remedies really are the ones our grandmothers swore by, and this one earns a permanent spot in my wellness routine. Number 2, melatonin. Melatonin is one of those rare supplements that I actually trust and recommend carefully. I used to think it was just another overhyped pill until I personally struggled with jet lag on a trip from New York to Tokyo. Nothing else helped, until a doctor suggested a low-dose melatonin routine. Game changer. Melatonin is a hormone your body already produces. It helps regulate your sleep-wake cycle. But blue light from phones, erratic bedtimes, or age-related declines can interfere with natural production. That's where supplementation can help, if used correctly. Too many people make the mistake of thinking more is better. But high doses, like 5 to 10 milligrams, often lead to grogginess, vivid dreams, or worse, sleep cycle disruption. The sweet spot for most adults is 0.5 to 3 milligrams, taken 60 to 90 minutes before bed. Let me share Ruth's story, a 66-year-old client of mine who used to stay up until 3 a.m. and couldn't wake up before noon. After just 1 week of taking 1 milligram of melatonin in the evening, she started falling asleep naturally around 10 p.m. and waking up refreshed at 6:30. It wasn't a sleeping pill. It was more like a gentle nudge to reset her clock. Melatonin isn't magic. But for jet lag, shift work, or delayed sleep patterns, it's one of the most precise and effective tools I've used, for myself and for others. Just be sure to pair it with good habits. No screens before bed, a calm environment, and consistency. Number 3, saline nasal spray. For something as simple as salt and water, saline nasal spray is a remarkably effective natural remedy. Its primary function? Mimicking the cleansing properties of ocean water to flush out allergens, irritants, and excess mucus from the nasal passages. This helps alleviate congestion caused by allergies, colds, or sinus infections. Medically, Saline doesn't shrink swollen tissues the way medicated sprays do, but it physically clears out mucus and keeps the nasal lining moist, especially important in dry indoor environments or during allergy season. Many anti-specialists recommend it before resorting to steroid sprays. A DIY version can be easily made at home. Mix 1 cup of boiled, cooled water with 1/4 teaspoon of non-iodized sea salt and a pinch of baking soda. Use a sterile nasal bulb or spray bottle. This version avoids preservatives found in commercial sprays and can be used safely multiple times a day. I've personally found that daily saline rinsing during spring drastically reduces my reliance on allergy meds, and patients with chronic sinus issues have told me the same. Unlike over-the-counter decongestants, saline is non-addictive and safe for regular use. Number 4. Sugar for hiccups. It sounds bizarre, but a spoonful of sugar has real merit in calming hiccups. The theory? Sugar activates the vagus nerve, the key player in the parasympathetic nervous system, which may help stop the spasms of the diaphragm responsible for hiccups. Here's how to do it. Take a teaspoon of granulated sugar and let it sit on your tongue until it dissolves. Don't chew or swallow right away. It's not guaranteed to work every time, but for many, especially those dealing with stubborn post-meal hiccups, it works like magic. This trick is a go-to in my personal remedy toolkit, especially after big meals. If it doesn't work on the first try, combining it with breath holding or sipping cold water can increase effectiveness. These methods stimulate the vagus nerve further, which is the actual target. It's one of those low-risk home interventions that has stood the test of time, and while we still lack large-scale trials, enough anecdotal support and small observational data points give this method credibility, especially since it's safe and easy to try. Number 5. Oatmeal for eczema. Oatmeal isn't just breakfast. It's a skincare powerhouse when used correctly. But the form matters. Colloidal oatmeal, made by finely grinding oats, is clinically proven to soothe itchy, inflamed skin, especially in people with eczema. When applied topically, colloidal oatmeal forms a protective film on the skin, helping retain moisture and reduce inflammation. According to dermatology research, it contains avenanthramides, antioxidants with anti-itch and anti-inflammatory effects. In practice, this means it's great for calming irritated, dry, or eczema-prone skin. Clinical studies, including one published in the Journal of Drugs and Dermatology, show significant improvement in itching and dryness after just 1 week of use. To use at home, blend oats in a blender until you get a fine powder, then add 1 cup to a lukewarm bath. Soak for 15 to 20 minutes. Alternatively, you can make a DIY oatmeal paste by mixing with warm water and applying to affected areas. I often recommend this to patients with sensitive skin looking for nonsteroidal options. It's especially useful for children with eczema flare-ups who may not tolerate medicated creams. The fact that it's natural, inexpensive, and supported by science makes it a win across the board. Number 6. Aloe vera. For generations, aloe vera has been the go-to remedy for sunburns. And it turns out that reputation is more than just folk wisdom. Research from the National Center for Complementary and Integrative Health, NCCIH, confirms that aloe vera can reduce pain and speed healing for mild burns and sun-related skin injuries. The secret lies in its plant chemistry. Aloe vera contains anthraquinones, compounds with analgesic, pain-relieving, and anti-inflammatory properties. These not only soothe the skin surface, but also encourage regeneration of the epithelial layer. It also helps to retain moisture, which is crucial for healing damaged skin. Many people ask whether they should use bottled aloe gel or apply the gel straight from the plant. My recommendation? If you have access to a fresh aloe vera plant, use it. Cut a leaf, scoop out the gel, and apply it directly to the skin. It's pure, unprocessed, and more effective. If not, choose a bottle version that lists aloe as the first ingredient, and avoid added alcohols or synthetic fragrances that can irritate skin further. Personally, I've found that keeping aloe in the fridge doubles its benefit. The cooling effect is incredibly soothing for sunburned or inflamed skin. For women who spend time gardening or walking outdoors, aloe can be a gentle, natural skin recovery ally that works without the sting of synthetic ointments. Number 7. Prunes for constipation. If you've ever rolled your eyes at the thought of eating prunes, it's time to rethink them. Prunes aren't just an old-fashioned remedy. They're clinically backed for digestive relief. What makes them special is their 1-2 punch. They deliver both fiber and sorbitol, a natural sugar alcohol. Fiber is essential for adding bulk and improving stool transit, while sorbitol acts like a mild osmotic laxative, pulling water into the intestines and softening stool. This combination creates a gentle, natural way to get things moving without the harsh effects of stimulant laxatives. A study in alimentary pharmacology and therapeutics found that prunes worked better than psyllium, a common fiber supplement, in improving stool frequency and consistency in people with chronic constipation. That's a big deal for those trying to avoid dependency on medication. That said, not everyone tolerates prunes well. People with irritable bowel syndrome, IBS, particularly the diarrhea predominant type, may find that the sorbitol increases bloating or cramping. Always start with a small portion and increase gradually. Here's my favorite prep tip. Soak 4 to 5 prunes overnight and eat them first thing in the morning, or blend them into a smoothie with banana and almond milk. It's tasty, effective, and surprisingly gentle. For women over 50 dealing with slowing digestion, adding prunes to your routine may be one of the simplest and most effective natural remedies you've overlooked. Number 8. Calamine lotion. Calamine lotion may seem old school, but don't underestimate its staying power. This pink lotion, composed mainly of zinc oxide, has earned its spot in modern medicine as a legitimate treatment for skin irritation, particularly from poison ivy, bug bites, and mild allergic reactions. Historically, calamine was dismissed by some in the medical community as a placebo, but recent reviews from dermatology studies confirm that it does reduce itching and helps dry out weepy rashes. Its astringent properties draw out excess moisture and create a cooling, protective barrier over the skin. One underrated benefit: using it cold. Store your calamine lotion in the fridge and apply it chilled for even greater relief from itching or heat rash. It's one of those simple tricks that makes a huge difference. Calamine doesn't treat infection, so don't use it on open wounds or severe burns. But for mild cases of itch or redness, it's a gentle, trusted friend. I recommend keeping a bottle in your medicine cabinet, especially during summer months when bug bites and allergic skin flare-ups are more common. For natural-minded women looking for non-steroid solutions, calamine is a proven choice with a long-standing track record. Number 9. Probiotics. Probiotics are among the most misunderstood supplements on the market, often touted as miracle cures for everything from weight loss to mood swings. The truth is, their benefits are real, but specific. The best established use for probiotics is in helping the gut recover after antibiotics. When you take a broad-spectrum antibiotic, it not only kills the harmful bacteria, it wipes out the beneficial ones that help regulate digestion, immunity, and inflammation. This disruption can lead to diarrhea, bloating, and yeast overgrowth. Probiotics help reseed the gut with good bacteria, restoring balance. Research in the Journal of the American Medical Association, JAMA, shows that taking certain probiotic strains, especially Lactobacillus rhamnosus GG and Bifidobacterium lactis, significantly reduces the risk of antibiotic-associated diarrhea. Timing matters too. Take them 2 to 3 hours after antibiotics to minimize conflict. Best sources? Fermented foods like plain yogurt, kefir, and sauerkraut are excellent. But for therapeutic effects after antibiotics, a high-quality capsule with clinically studied strains is best. Look for products with at least 5 to 10 billion CFUs, colony-forming units, per dose. From personal experience, I've found that pairing probiotics with fiber-rich meals, like oats or berries, enhances their effect. For post-antibiotic recovery, or even during flu season to support gut immune balance, probiotics are a natural choice with solid science behind them. Number 10. Duct tape for warts. Warts might seem like a minor cosmetic nuisance, but they're actually caused by the human papillomavirus, HPV, and they can be stubborn to treat. Interestingly, one of the most low-tech solutions also has some surprising science behind it: duct tape. This approach is called the tape occlusion method. The idea is that when you cover a wart with duct tape, the friction, minor irritation, and oxygen deprivation stimulate your immune system to attack the virus at the site. Here's how to do it. Cut a small piece of duct tape and place it directly over the wart. Leave it in place for 6 days. If it falls off early, replace it. On day 6, remove the tape, soak the area in warm water, and gently rub with a pumice stone. Leave it uncovered overnight, and then apply a new piece the next day. Repeat for up to 2 months. While results vary, it's a safe, non-invasive first-line treatment, especially for kids. If this method doesn't work after 6 to 8 weeks, you might consider salicylic acid or cryotherapy. It may sound unconventional, but sometimes the simplest solutions work best. And yes, your toolbox might just have wart medicine in disguise. Number 11, tea bags for eye styes. If you've ever had a painful, swollen red bump on your eyelid, yes, that's a stye, and it's usually the result of a blocked oil gland that becomes infected. Before you reach for antibiotics or panic, look no further than your kitchen. A used tea bag might be your new best friend. This age-old remedy works on the principle of a warm compress, which helps loosen the clogged gland, encourages drainage, and soothes the surrounding tissue. But what makes tea bags even more effective? The antibacterial and anti-inflammatory properties of both black and green tea. To use, steep a tea bag in hot water as you normally would. Let it cool slightly. Make sure it's warm, not hot, and gently press it against the closed eye for about 10 to 15 minutes. Repeat this 2 to 3 times a day with a fresh tea bag each time. Within a few days, most styes resolve on their own. But if the swelling spreads, vision blurs, or the stye doesn't improve after a week, consult your doctor. Sometimes the best remedies are the ones our grandmothers already knew. Tea isn't just for sipping. It's a gentle healer too. Number 12, ginger tea versus ginger ale. We've all heard the advice. Drink ginger ale if you feel nauseous. But here's the truth. Most commercial ginger ales contain little to no real ginger. And worse, they're packed with added sugars and carbonated acids that can actually worsen stomach upset. Ginger root, on the other hand, has been used for centuries as a proven natural remedy for nausea, indigestion, and motion sickness. Studies have shown that ginger contains compounds like gingerol and shogal, which help relax the gastrointestinal tract and reduce the signals that trigger vomiting. So how can you make a real ginger remedy? It's simple. Peel and slice 1 to 2 inches of fresh ginger root. Steep in hot water for 10 to 15 minutes, strain, and sip slowly. You can add lemon or honey for taste and added benefits. But here's an important safety note. Ginger in large doses can thin the blood. So if you're on anticoagulant medications or preparing for surgery, talk to your doctor first. Forget the soda aisle. Real ginger tea is soothing, effective, and refreshingly free of unnecessary sugar. While many natural remedies have proven benefits, others are more myth than medicine. For instance, placing raw onion on the chest to draw out infection has no scientific backing. Nor do essential oils function as substitutes for antibiotics, a common and dangerous misconception. The truth is, anecdotal evidence is not the same as clinical proof. What works for one person might be a coincidence, a placebo effect, or even harmful when applied incorrectly. If you see a tip on social media that sounds too good to be true, double-check it with science. Look for credible sources like peer-reviewed studies, major medical organizations, or licensed practitioners. Natural medicine can be powerful, but to use it wisely, you need to distinguish between folk wisdom and evidence-based remedies. Your health deserves more than a Facebook post. Let's recap. From raw honey for coughs to duct tape for warts, the natural world is filled with simple remedies that are accessible, affordable, and clinically validated. These aren't just old wives' tales. They're tools that doctors trust and use. But remember, natural does not mean harmless. Always consult your healthcare provider, especially if you're managing a chronic condition or taking medications. The beauty of these remedies is their simplicity. You don't need a pharmacy drawer filled with expensive products. Sometimes, all it takes is a spoonful of honey, a tea bag, or a pinch of salt water. Here's your challenge. Try just one of the remedies we discussed today. Notice how your body responds. Share your story in the comments. I'd love to hear what worked for you. Knowledge is powerful, but only when applied. Keep learning, keep experimenting safely, and remember, nature has always been a quiet healer. Now, science is catching up. Stay curious, stay empowered, stay healthy.